Yes, I have to have surgery again. Where do we start? So let's start from the beginning. So I had my breast surgery around the end of January. Okay. Maybe about a few months later, I'll say March, April, I started experiencing some different menstrual cycle symptoms that I wasn't usually having. Since I've been vegan, my periods have been very light, very unproblematic. I don't have cramps, anything of that nature. Well, earlier this year, I started experiencing some cramps with my period, and I'm like, okay, that's a little bit different. This isn't what I'm usually used to. And then in addition to that, I would feel some ovulation pain, always on the right side. It would be a very sharp pain, kind of have me, clutching my stomach, doubled over a little bit. And I was like, you know what? I think I want to get this checked out just to be safe, to make sure it's not anything going on. Side note, I had a cyst removed from my right ovary over 10 years ago. It was a dermoid cyst. If anybody's familiar, dermoid cysts are a little bit differently. Those will not resolve on their own. They had to be surgically removed. So I had one of those removed. So when I experienced this pain, I was concerned that maybe I had another cyst or something was back on this ovary. Well, I went to the doctor, and at this time I was uninsured because I had lost my job. I just wanted to get a little checkup just to see what was going on. The doctor did say that she felt some fullness on a pelvic exam on my right side, and it was recommended that I get an ultrasound. Again, at that time I wasn't working. I didn't have insurance. An ultrasound was not something that I could necessarily bring into my budget at that time. So I opted to wait. Fast forward, once I started working and got benefits again, early August, I decided to go get it checked out. Now, I went to a different OBGYN than what I normally go to because I decided that I wanted my healthcare team to be all people of color, preferably Black doctors, Black everything. That's just my preference. I'm a Black woman. I feel like having a provider that looks like me, is like me, knows what goes on with our bodies and how different it is from, other ethnicities. I wanted to have a Black OBGYN because my previous OBGYN was not. So I went to this new doctor's office. I got the ultrasound. I found out that I had a cyst on my right ovary. They said it was a cluster of cysts, probably like 3 to 4, with the largest being around 5 centimeters. Side note, they said that it was a follicular cyst, which follicular cysts are usually fluid filled. They can go away with a couple cycles of your menstrual period. And a lot of times women don't even know that they have them. They kind of resolve on their own. Since mine was getting to a larger state, they wanted to do some follow-up testing. So they decided to do a aroma test, which was to test for any malignancy, cancer markers, just to make sure it wasn't anything else going on with it. Because outside of it looking like a follicular cyst, there were also some changes to it where they now labeled it a complex cyst. Again, so they wanted to do some further testing. So I got the aroma test, which is a blood test, and then I never heard anything back from this doctor's office. When I say I never heard anything back, I sent messages on the patient portal, a couple of them. I called the office, left messages. Nobody never got back to me to this day. Now, usually no news is good news when it comes to lab tests. However, with this office, in my experience, I had a lab test that was abnormal and nobody called me. The only way I was able to get somebody to look at my test was when I went into the office and I said, hey, I had XYZ done. It was for a UTI, like I had a UTI. I said, hey, I got XYZ done, and I never heard anything about it. Was everything okay? And then it was like, no, it wasn't. Da 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 da. So their track record was pretty bad. So after not hearing from this doctor's office, I said, you know what? Let me go back to my original OBGYN that I've had since I've lived in Atlanta, which, like I mentioned, was not somebody who looked like me. However, when I say that this office, my nurse practitioner and my doctor at this office are so thorough, they listen to me, they explain everything so well. I feel like they genuinely care about me and my well-being and making sure that I'm better. This is where I should have stayed at this whole time. So I went back in to get a follow-up ultrasound. I actually went in to get my annual. And, I told her everything that was going on, what happened at the previous doctor's office, what they said the cyst was. I told her that I was still experiencing some pain and, what can we do now? So she was going to request records from the previous doctor's office just to see what the ultrasound report showed and then get the results for the Roma test that I had. Well, I got the follow-up ultrasound and that showed that the cyst had grown and now it was measuring around 8 centimeters. When she reached out to me to give me my results of my ultrasound, she told me that she never heard back from the other doctor's office to send the records over. So now the plan was to do an OVA1, which is similar to a Roma test. And if anything came back positive, then I would have to go to a specialist, a GYN oncologist, to follow up and then discuss surgery or whatever would be next. Got the OVA1, everything came back negative. Thank you, God. No malignancy, no cancer markers, everything was normal. So the next step was to have an MRI to kind of look at it, get some better pictures of it, and then we'll discuss surgery options after that. Okay, cool. I don't really want to have surgery, but at this point, I'm like, okay, it's uncomfortable. It's growing. It's not getting any smaller. We've got to do something, right? So I'm waiting to get my MRI, which is actually tomorrow. And in the meantime, last week, I had a trip to the emergency room. If you didn't see my last video, at the end of it, I talked briefly about going to the emergency room for some pain. Well, when I tell you that was the worst emergency room experience I have ever had in my life, it was the worst, the absolute worst. And here's why. I was at home carving pumpkins, enjoying my life, when I started to have some cramping. Granted, this was my first day of my cycle, and typically the pattern has been I'll have ovulation pain and I'll have cramps the first day of my period. So this was right on track, having cramps. However, these cramps were very intense. It was so intense that I had to stop carving my pumpkin. I finished it, but I was trying to clean it out. I was over the sink, rinsing out like just rinsing it off. And it's like, I couldn't do it no more. I had to go sit down. I came and sat down on the couch. I couldn't get comfortable in any position. I got upstairs. I was like, let me go take a shower. A nice hot shower always makes me feel better. So let me go take a shower. I took a shower. I put on some pajamas, more comfortable clothes. Granted, my shower was like 2 minutes because I couldn't stand to be in there for that long. But then after I got out, I just could not get comfortable. It was intense. No position was right. It was to the point where I was crawling on the floor like I was in a lot of pain. And my doctor had told me, since my cyst was a little bit larger, there's a chance for a rupture, and then there's a chance for a rupture, and then there's a chance that it could twist and, cut off some blood supply. If I ever was to experience any type of extreme or excruciating pain, it could be a medical emergency, and then I would need to go to the ED. So while I'm going through all of this, I'm like, is this what she was telling me about? Like, is this that pain? Like, am I tripping? Is the pain really as bad as I think it is? Like, I was so trying to figure this out in my head. Like, I didn't really know what was going on. All I know was that I was struggling and I was like, I think I need help. I think I need to go. Mustered up some energy and drove myself to the emergency room, which, looking back, I really wish I would have called somebody because it was very challenging. Like, I was praying my way all the way there. Luckily, it's not that far from my home. It was less than a 10-minute drive, but it was a struggle to get there. So I get there and pull up, and the emergency room is packed. The parking lot is full. I'm like, oh no, it's crowded in here. This is going to be terrible. Like, I just knew looking at the parking lot. But it's like, at this point, there was no turning around. I had to get seen. So I parked. I think I used up all of the energy that I had from getting dressed, driving, and then walking into the emergency department. That once I got in there, I'm telling you, I thought I was about to pass out. I thought I was going down. Like, I started getting lightheaded. I had to lean on a little post that separates the line. There was one person in front of me, so I'm leaning on a post, and I'm like shaking at this point, just like struggling. And I want to tell somebody that I need help, but I also have no energy and nothing in me to tell anybody that I need help. I'm just like, because I'm like, what is going on? Like, it was a very scary moment because I really thought I was about to be on the floor. So the person in front of me goes up and they go get checked in. And then it's my turn to like move up. And I was literally like stuck at this point. Like, I couldn't move. I couldn't do anything. Now, to the left of me, over in the corner, is an older Black man. And then the one young lady who's like, you know, people coming in asking him, are you here to be seen? Are you here to see somebody? Like, she's kind of like the hostess, I'll say, like the greeter at the front door at the little post. So she telling me, I think she was telling me to like move up or whatever, but I couldn't. So I kind of just looked at her, like my eyes were like pleading, like I need help, but I couldn't like verbalize it. So she looked at me. She was like, ma'am, do you need a wheelchair? My good brother over here, my advocate, was like,
yes, she needs a wheelchair.
Because he saw that I was struggling.
He was like, yes, go ahead and tell him you need to get you a wheelchair. Go ahead and sit down, get you a wheelchair.
And all I could do was just nod my head like, yeah, I do. And I basically fell into the wheelchair. And at this point now the tears are coming out. I'm still shaking. I'm in so much pain. So then I get up to go get checked in, and I can like barely get my words out. I've never been in pain like that, where outside of labor, where it's like I can't even talk. Like, my words is like one word and breaths at a time. So I'm like, I have, like, that's how I was talking, that slow and like real low. Like, I couldn't, it was so dramatic. It was so dramatic. And it was horrible, especially to be there by myself. Like, it was so bad. So they wheel me over to go sit in the waiting area. And the whole time I'm just praying. Like, please let them see me soon. Please, I hope I don't have to sit out here for a long time. Please, please, please. I'm praying. Like, tears is falling. My nose is runny. Like, it was a mess. Guy calls me to do vital signs. Now, he doesn't even look up. I feel like he called my name and didn't even look up to see where the person was. So he calls my name. And like I said, I'm in a wheelchair, but I'm not even in a wheelchair that I can wheel myself. I'm in a wheelchair that somebody has to wheel me in. And as much pain as I'm in at this point, like, I can't get up and walk to him. So he calls my name. I see him because he's like, my wheelchair is facing this way, but he's over here. So I can see him over here, and I tried to put my hand up to like signal like, here I am, but he's not looking up from his computer. I can't make eye contact with him, like, struggling. And you know, nobody else in the ER was really paying any attention to like me, so I couldn't even get anybody else's attention to like, hey, can you just let him know that I'm right here and help me. Anyhow, I end up going back. They wheeled me right in the hallway, just right on the side of the hallway. The PA come up to me, ask me what's going on, and then she, you know, makes a plan. They want to rule out an appendicitis because it's in the same area as, you know, where I was having my pain, even though I told them that about the cyst. So they wanted to rule that out, and then they wanted to do an ultrasound and a CT just to make sure everything was okay. When I tell you, this process took forever. I don't think I got anything for pain. I didn't get anything for pain before I went to ultrasound. So I was sitting there in pain for maybe like 4 hours. 4 hours. Everything took forever. They wasn't really help. Like, I had to tell them that I need help. You don't see the distress that I'm in. Like, I need some assistance here. Anyhow, after all of that, and I came back from ultrasound, and I'm finally getting, you know, my IV and pain meds, which, side note, I'm such a hard stick that was torture too. They sticking me, my IV infiltrated, just a lot. Now, after I got my IV and I got fluids and my little bit of pain medicine, they stick me in this room with all these other people. And this room is so tiny. Like, it may be the size of I don't even think, it's probably like half the size of my living room. It's around the size of my living area right here. And then they got all these recliners in here of people just sitting. No curtains in between you. It's just an open room with these recliners thrown in, kind of like jumbled together. They not even straight, some facing each other. So when you put your feet out, like you might be bumping this one and wheelchairs can't get through. Lady next to me is over here throwing up her entire intestines. Other lady over here is complaining about needing more pain medicine. Dude across from me sound like he got COVID and is coughing up all his lungs. And I'm just in this room like, is this what the American healthcare system is like now? Why are we all in this room together? Why? What is happening? But at this point, I am so like out of it, child, a mess. When I just tell you, I went in at 10 p.m., got home at 7 a.m. The good thing was the cyst had not ruptured. The cyst was not twisted. The blood supply wasn't being cut off. They just said that it now was 10 centimeters. So back in August, it was 5. The beginning of October, it was 8. And now by the end of October, it was 10. So now it's growing. It grew significantly. If you're not familiar with sizes in centimeters, here is what roughly 10 centimeters look like. So it's probably the size of like an orange, which if you can imagine something like this, just in a space that it don't need to be. So it's a lot of pressure right there right now that I can feel. I can feel it in my back. It just feels like something is there. I don't know any other way to describe it other than it feels like something is there. It feels very uncomfortable. After I left there, I immediately messaged my doctor on the patient portal and said, I absolutely cannot go through what I just went through ever again. Can we possibly look into getting surgery scheduled sooner rather than later? Because mind you, we were waiting to get the MRI results to kind of figure out what the next plan of action was and when we would do surgery. She called me, and like I said, I love this lady with my whole heart. She called me like, oh no, she's so sympathetic, empathetic. She's like, oh no, I'm so sorry that you had to go through what you went through. She talked to the doctor, my doctor, and they decided that we're going to go ahead and get the surgery booked even before we get the MRI results, just to get you on the schedule as soon as possible so we can get this taken care of so you can be no longer be in pain. Thank God. Even though I am very scared, surgery is nothing to play around with. You know what I'm saying? There's always risk involved with surgery, right? Nobody wants to get cut open. It's not fun. You have downtime. You might be in pain. Nobody wants to deal with that, right? But this is necessary. So unfortunately, I do have to get surgery again. And my surgery is actually scheduled for next Friday. In context, today is Monday. So next Friday, I'll be getting my surgery. Tomorrow is my MRI. And then Wednesday is my pre-op appointment. So I really just wanted to share this experience with, other women that may be going through this, that may have never experienced anything like this, that may have questions, may be uneasy, maybe need to see somebody who looks like them. Maybe you look like me. Whatever the case, I always want to share my stories and when I go through stuff like this, because there's other people out there who are going through the same thing. And you're not alone. You're not alone. That's all I can say is you're not alone. So I just want to let you know that if anything feels off about your body or anything changes with your body, not just talking about your menstrual cycle, just anything. If anything in your body is not what it used to be, or you gradually notice that things are changing, just go get it checked out. It's so much better to be safe than sorry. Because imagine if I never got this checked out and this cyst is just growing bigger and bigger inside of my body, or I ignored my symptoms, because a lot of time we will ignore some symptoms. It could be getting bigger and bigger, and then, it could rupture. I could lose an ovary. Believe it or not, at this age, I still would love to have more kids. So I'm not doing anything to jeopardize, my health. So it has to be done, and I will be having surgery. So we will continue this journey along together. I will share and take you all with me on, everything and what it's like and what this experience is. And hopefully it helps somebody. But am I scared? Absolutely. Am I relieved that it's finally going to be gone and I'm going to be pain-free? Absolutely. So that's basically what's going on with me right now. And I'll keep you all posted.